So welcome back to my channel. Today we are going to be discussing hypertension again. My name is Mrs. Caroline. If you haven't yet subscribed, please subscribe at Life with Nurse Carol so that we get more content, so that we get educated on different things, pharmacology, different diseases, life, and other things. So hypertension, we should note that hypertension is one of the most common non-infectious diseases that's affecting most of us in the world. But what is its definition? So it's when the force of blood pushing against your artery walls is consistently too high. So this should not be a one-off when you're anxious and scared of an exam, or there's something that's heavily stressing you at the moment, and then you take your blood pressure, then you feel just because of the one time you've taken it, you're hypertensive. No, it should be a consistent value that you keep getting over 3 or 4 times. Then that's when you'll be diagnosed with hypertension. It's also called a silent killer because it usually has no warning signs or symptoms, and many people do not know that they have it. And you should note that the higher your blood pressure levels, the more risk you have for other health complications such as heart disease, heart attack, and stroke. So looking at the World Health Organization key facts that were out in March 2023, an estimated 1.28 billion adults aged 30 to 79 years worldwide have hypertension, and most of them, which is 2/3, are living in low and middle income countries. The low and middle income countries, I would confidently state that Africa is among them, and maybe some bit of Asia. So most of us are affected, and we should take serious note about this. It goes ahead to say that an estimated 46% of adults with hypertension are unaware and they have the condition. So as you're counting in the communities, look out for the adults, and close to 50%, close to half of the population of adults, it says that you're not aware that you have this disease. Less than half of the adults, which is 42%, with hypertension are diagnosed and treated. This is worrying. Approximately 1 in 5 adults with hypertension have it under control. So the population that we are living in, those that have the hypertension, and there we are considering the remaining 54% that are aware that they have hypertension. Out of the 54%, only 1 out of 5 has it under control, meaning the 4 out of 5, which is close to 79%, are not having it under control. This is so worrying, and we should take serious note. How do we classify blood pressure? So depending on the numbers that you score, usually blood pressure is scored with 2 values. The upper one, which is the numerator, over denominator. The numerator is usually a systolic value that indicates the contraction of the heart or the pressure that is inserted on the arteries, on the vessels when the heart contracts. The lower or the denominator value indicates a value or a number or the pressure that's exerted on the vessels when the heart relaxes. So we have a systolic over a diastolic. The normal blood pressure is usually 100 to 120, and the diastolic is usually 60 to 80. When you have values between that, you're perfectly very fine, and you keep taking the blood pressure on consecutive times, you do not have to worry about your health. However, there is what we call the elevated blood pressure. It is not abnormal, but if you start getting these values, you need to take more caution on what you're eating, on your lifestyle, like exercise, and you need to be more concerned on taking your blood pressure to see that it doesn't go beyond this. And the values to that is 120 to 129 over 80. So the value, that the denominator value can be still under 80, but when the systolic shoots to 120 to 129, you're normal, but you need to start taking precaution. Then we have the stage 1 hypertension, which is valued to 130 to 139 over 80 to 89. This is what they call a stage 1. And every other time they take your blood pressure over 3 consecutive times under different condition, and you see that your blood pressure is between these values, you need to start worrying. You need to start acting. You need to start taking life more serious than you have been taking it. Stage 2, 140 or higher over 90. So here, be well assured that you're hypertensive, and you need to take it more serious than even the stage 1. And in case you've seen a doctor and they've prescribed something, make sure that you're adhering to that. Make sure that you're taking your lifestyle changes more seriously than ever. However, moving ahead, when you go to a blood pressure of greater than 160 over greater than 90, you should be worried. It's called a hypertensive crisis. And here you need an immediate intervention, or else you get complications like a stroke or something worse than that, which could be death. So there are basic types of high blood pressure. This doesn't make them different. They'll literally present the same, but the types are classified due to the causes. So we have primary hypertension, and in here the causes are more common. This is the most common type of blood pressure, and the causes are more related to aging, lifestyle, which includes eating badly, not getting enough exercises. So you literally see yourself running into this high blood pressure. One, there are things that you can control, and there are things that you cannot control, like aging. You can't control aging. Lifestyle, that's within your hands. You can change that. Secondary hypertension, the causes of this type of blood pressure include different medical conditions or medications that you're taking. So literally here, this secondary hypertension is coming due to another existing condition. You didn't have it initially, you're not old, you may not have the predisposing factors of a primary hypertensive patient. You're running on well, your lifestyle is in check, but then because of the other medical condition that you've developed, you end up getting secondary hypertension. So here we go ahead to see that primary and secondary hypertension can coexist. So what they're trying to tell us, that someone can actually have both, where you have primary and secondary hypertension, but at the end of it, it basically means that you have hypertension. And the example of this is a new secondary cause can make blood pressure that's already high get even higher. For example, you're already a hypertensive patient, but then due to other causes, you develop renal failure. Already renal failure is enough to cause hypertension. So you have the primary hypertension that you already developed, but because you have a kidney disease, it will also worsen the already existing high blood pressure. So you have secondary hypertension on primary hypertension. So the causes of hypertension, we should know that the causes of both primary and secondary hypertension can overlap, and they could be the same actually, they could be similar. However, for primary hypertension, there is not a single clear cause. There are so many factors that come in touch to contribute to this hypertension. It could be because you're aged, but because you also have a family predisposition of this disease. It could be you're aging, but also your lifestyle is not in check. So you can't clearly put your hands on this is what exactly caused this. That's what primary hypertension is. However, the common causes include age. Being older predisposes us to so many chronic conditions because our body fails to adapt so many things that you were adapting to when you're younger. Second, having unhealthy eating patterns. Like we have a tendency of eating so many foods that have high sodium concentrations, foods that have high cholesterol. These will clearly damage our lives and predispose us to hypertension. Lack of physical activity. This could be intentional, where someone thinks they should first develop a chronic disease before they hit the gym, or it could be due to disease. Some people are immobile due to deformity, some people are immobile due to chronic illnesses. So all these can predispose you to hypertension. Consumption of beverages containing cholesterol or other stimulant drugs. These clearly will affect your heart, these will clearly affect your vessels and predispose you to hypertension. Secondary hypertension. So like we said, this is usually happening following a medical condition, following an occurrence, following maybe a medication that you've been on. So this at least has a distinct cause. However, some of the common causes include certain medications like immunosuppressants, NSAIDs, and oral contraceptives. So if you're taking these, be on a lookout. Take your vitals seriously, take your blood pressure seriously. If you have kidney diseases, you know that kidneys are responsible for clearing all the toxins out of the body, clearing out of the excess fluids in the body. And if they are failing, all these will accumulate in the body and predispose you to conditions, for example, hypertension. Primary aldosteronism. So aldosteronism is when your body produces a lot of aldosterone hormone, and this is responsible for the retention of water and sodium in the body. The more water and sodium that's retained in your body, the higher it contributes to the blood pressure, hence causing hypertension. Use of recreational drugs. Most of these are stimulants, and they don't only stimulate your mood, but they will stimulate every organ in your body, including your heart, hence predisposing you to hypertension. Renal vascular diseases. Renal is literally the kidneys, so it has a similar situation with the kidney diseases. Tobacco use. Tobacco usually affects your vessels in ways that if someone is not taking it, you're not more predisposed than someone who is taking it. What are our risk factors? So risk factors usually tell us that in case we are able to control these things, if they are within our means, then we are risking less. We are predisposing ourselves less to these chronic diseases. There are things you control and there are things that are beyond your control. For example, if you have a risk factor of a family history of hypertension or cardiovascular diseases or diabetes, this is not something you can control. You can't change the genes of your family tree, so you just have to take precaution. Make sure that you monitor yourself frequently and regularly so that when this starts to grow in, you can capture it at an early stages. Second, We have medications, for example, medical conditions. If someone has chronic kidney disease, metabolic syndrome, obstructive sleep apnea, or thyroid disease, these people are at a very high risk of developing hypertension, and someone needs to monitor them, or they need to monitor themselves very closely and monitor their blood pressure more seriously. Stress. We can never live in a world free of stress. In one way or the other, there'll be stress in the home, there'll be stress at work, there'll be stress everywhere. As you're moving to work, as you're playing with anyone, you get some bit of stress. However, if you can't control your stress, keep it in check, you're at a very high risk of getting hypertension. Age. That I've already explained, that the older we get, the more we are at risk for chronic illnesses. Ethnicity. So Africans, we are at more risk of getting hypertension just by the fact that we are Africans. So if you're an African, don't feel like maybe this is something, maybe you're special. It's by ethnicity that we are more predisposed to hypertension than any other race. Being obese or overweight, you need to monitor your weight very closely, because the higher it goes, the higher the risk of getting so many chronic illnesses. Sedentary lifestyles or lack of exercise, poor diet, smoking and alcohol, all these predispose us to hypertension. So what should we worry about this hypertension? So every other time someone is diagnosed with hypertension and you've confirmed your diagnosis, one of the major things that we are giving you all this medication, telling you all these interventions, is we want to prevent complications, because complications are life-threatening and can cause death at any point. And some of the complications of hypertension, we have coronary artery disease, we have stroke, we have a heart attack, peripheral artery diseases, kidney diseases and failure, complications during pregnancies, eye damage, vascular dementia, and so many. There are so many complications of hypertension. And every other time you're diagnosed with this, make sure that you adhere to the routine or the medication that the doctor has prescribed or the healthcare workers advice that you've been given, so that you don't get far into the complications. Management. So everyone is interested, if I have hypertension, how am I going to get better? How am I going to move on with my life regardless that I've been given this diagnosis? One, there are majorly two things that you can do to manage your hypertension. One is the lifestyle changes. Whether you're on your medication or not, make sure that you change your lifestyle to fit a healthy person. Make sure that you include things that you were neglecting that are more important for health than those that you were considering to be pleasurable. Second, we have medical interventions, and here they will involve giving you medicines that you have to adhere to the list as prescribed. So the healthcare providers will recommend treatments based on your blood pressure readings, the cause of your hypertension, and the underlying conditions. So if your blood pressure is still in the initial stages of hypertension, you find that you get more lifestyle change advices compared to the medical interventions. However, if your blood pressure is shooting, lifestyle changes may not do it for you. They'll have to combine medical interventions and lifestyle changes. So lifestyle changes, this is something that I've been discussing ever since we started. Keep a healthy weight. Keep a healthy weight. I can't emphasize that enough. A health weight is different for everyone. So don't say because my friend is 80 and their BMI is normal, maybe I target to be 80. You could be shorter than that person. So keep a health weight for you. Limit your alcohol consumption. Exercise. In general, it's very difficult for anyone who has not had a very active lifestyle to start exercising. So what is the rule? Start slow and then go on improving day by day. So work your way up to 150 minutes of aerobic exercise per week. So if you can have that, that's the minimum. That's the minimum to keep you at least in check. That will be good. Eat a healthy diet. There's what we call a DASH diet. This is recommended for people with cardiovascular diseases and for people with hypertension. And this usually includes large amounts of fruits, vegetables, whole grain, and a low-fat diet. Another thing, as we talk about a healthy diet, you need to cut down on your salt intake. Salt is really dangerous and it's one of the major causes of hypertension. Monitor your cholesterol intake and manage your stress. So while you think, I'm too stressed, you keep talking about this and you keep taking it very lightly, this can actually damage your life and give you a chronic disease that you have to live with for the rest of your life. So manage your stress. Medications. This will be a summary of the medication, but if you want detailed information about this, you can go to my channel. There is a full detail of each of these medication classifications, and they will tell you the examples, they will tell you how they work and their side effects. However, the medications, I prefer to classify them as A, B, C, D. It helps you remember which medications are taken during hypertension. Also, you should note that someone diagnosed with hypertension can be prescribed one or more of these medications considering the different classifications. So you could be given a medication from this first group or the second group or any other group or combined from different groups so that the effectiveness is better. One, we have our A, which is the angiotensin converting enzyme inhibitors. So these literally block the production of angiotensin 2 hormone, which the body naturally uses to manage blood pressure. When the medicine blocks angiotensin 2, your blood vessels do not narrow. So in summary, the angiotensin 2 hormone is a major vasoconstrictor, and every other time your vessel is like this, when the moment it constricts smaller to a smaller diameter than that, eventually your blood pressure, the blood pressure inside that vessel goes high, hence contributing to blood pressure. So these medications are acting in a way to block that hormone, the hormone that causes vasoconstriction. So at the end of it, your vessels will be relaxed, hence allowing the blood pressure to go lower and reducing the effect of hypertension. The second A, we have angiotensin 2 receptor blockers. So the other ones were inhibiting the production of angiotensin 2. These ones are blocking the receptors where this hormone should bind and have effect. So these block the same hormone from binding the receptors in the blood vessels. The ARBs work the same way as the ACE inhibitors to keep the vessels from narrowing. So at the end of it, we just don't want the effect of angiotensin 2, whether by limiting its production or limiting where it has to bind so its effect is not felt. You can control your blood pressure. Beta blockers. So beta blockers help to reduce the speed, or what we call the heart rate, and the force of contraction of your heart. So while doing that, they will lower your blood pressure. They work by preventing a hormone called adrenaline. So this is a hormone that's usually produced in fight or flight. Every other time you're scared, there's a production of this hormone that will force you to do things to cope with that situation. And so when you give beta blockers, they prevent this hormone from binding onto the receptors. There are different receptors like beta 1, beta 2, beta 3, and these receptors are located in different areas. So the moment you give beta blockers, you need to know that its effect is to prevent the effect of adrenaline, because it will occupy the receptors where it would have bound. And all these medication, you see that thing that I've highlighted in green, it's usually the ending of those medications. Like the beta blockers end in lol, like atenolol, those are beta blockers. We have our C, which are the calcium channel blockers, and these majorly prevent calcium from entering into the muscle cells of your heart and blood vessels, allowing these vessels to relax. Calcium has a major play of causing constriction or contraction. So every other time calcium is allowed to enter into your cells, there is an effect of contraction, whether it's at the heart level or the blood vessel level. These will contract, and the more they contract, they will increase the pressure at which the blood is pumped out. So when we give the calcium channel blockers, they'll prevent calcium from entering into the cells. Most of the calcium channel blockers end in dipene, like for example nifedipine, and every time you hear a dipene, sense that that's a calcium channel blocker. Last but not least, we have the diuretics. So these are locally what we call the water pills. Because they help you flush out the water, they will cause a lot of urination. Because the more you flush out that water through your kidneys, the less volume remains at the blood level, hence reducing your blood pressure. So these flush the excess sodium from your body, reducing the amount of fluid in your blood. People often take diuretics with other high blood pressure medication, sometimes in one combination. These water pills can end in semide or lactone, depending. There are different types of diuretics, as we'll be discussing at the channel at an individual level. So we have the furosemide, like for example furosemide, it's a different type of diuretic compared to the spironolactone. It also works differently. There are some that are potassium sparing, there are some that will flush out everything, sodium, potassium, and everything. So as we go on with life, we need to accept that if you're given a diagnosis of hypertension, know that this is a lifelong thing. You need to know that if you're in the early stages, lifestyle changes can help you out. But if you're in the severe stages, lifestyle will not help you out. Don't lie yourself that I'm going to hit gym now, even when I have a blood pressure of 150 over 90 and everything is going to work out. No, your healthcare provider will decide that, and if you're given medication, make sure that you adhere to those medications and make sure that you take them very religiously. Again, I want to thank you for watching. Please check out the detailed videos on antihypertensive medication. Don't forget to watch. Don't forget to like. Don't forget to share. And most importantly, don't forget to subscribe and Life with Nurse Carol. Don't forget to share your experience with hypertension. Also, don't forget that herbs are not going to heal your hypertension. You only manage your hypertension in the hospital on the medication that you've been prescribed and on the lifestyle changes. Thanks for watching. Love you. Take care.